can. Let's see. Okay. All right. So we're good to go. Oh. All right, now we're organized. All right. Thanks, Joel, for doing that. I know it was hard to kind of get in. So we're this is the Human Services and Community Safety Committee, and I'm going to get started here. It's important to understand that no formal vote or decisions about city programs, policies, or budgets will happen here. Our role is to explore various topics with staff and stakeholders and community members, and to make recommendations to our council colleagues. We want this process to be transparent, inclusive, and easy for you to be a part of whenever you choose to be. And you can share your thoughts with us by filling out a comment card, or an item, or by looking up an item that's on the meeting agenda, or by reaching out to us directly with any other thoughts or questions or ideas. We need you to fill out a comment card in advance that can be read into the record for any agendized item. The link to the comment cards can be found on our committee webpage at www.tempe.gov/HSCS. And you will also find contact information for committee members and staff there for non-agendized questions as well. All right, so we're going to go to agenda item number 1, and we are going to call for a motion to approve our minutes from December 7th.
So moved.
All right. And I second, so that motion carries. Actually, that was item number 2. I apologize. All right. Item number 1 was just calling this meeting to order on December 7th, 2022. All right. I'm mixing this all up here. Sorry, Joel. You're not here and I'm falling apart, Joel.
Great.
Okay, so the motion was to approve the October 19th, 2022 meeting minutes. So Joel, do you second that?
Second it.
All right, that is then been approved. All right, so item number 3, we're going to go to comment cards. Paul, it's all yours.
All right, thanks, council members. I appreciate it. So as I said before, I'm not sure if everybody was here to hear it, but we are not reading all comment cards that were submitted 2 hours ahead of the meeting time, which was the deadline. We are not reading those, but I wanted to acknowledge that those folks we had received their cards. That was Roderick J. Hurdle Bradford, Bobby Taylor, Kylie, Kiana Maria Sears, Jim Singleton, Joyce Clinton, Sam Batts, Jay Sidhu, John McElliott, Deborah Mansberger, Michelle Thompson, Elizabeth Hicks, Mo Ayufe, Gurpreet Sandhu, Akil Altai, Philip Carpenter, Luke Douglas, Donna Williams Esquire, Sherry S., Sam Yulan, Dr. Jennifer Muhammad, Hesham Hamid, Cynthia Stremba, Timothy Fleckenstein, Shonda Maxwell, Joanna Strother, Liz Goodman, Shannon Howard, Jennifer Speck, Olivia Barber, Laureen Taylor is the last on this list. Now, if any of those folks are on the call on this meeting, you can always raise your hand or just let it know on the chat that you would like to speak. I see that several people have utilized the chat to bring it to my attention that you would like to speak. I will make sure that your voice is heard. So we will be hearing from the following folks. I will go ahead and unmute you. So recognizing first, and just please be aware that there is a 3-minute time limit that we will be enforcing. So our first speaker today is Amanda Gray. Amanda, you are unmuted. Please make your comment.
Thank you, council members and staff. My name is Amanda Gray. I'm the executive director of the Arizona Petroleum Marketers Association. We're a trade group representing convenience stores and fuel retailers. Our members are community partners that offer critical items like fuel and food for customers who live, work, and play in the city of Tempe. APMA members do not want their employees to sell age-restricted products to underage individuals. For the average C-store, roughly 1/3 of their in-store revenues are from tobacco or vapor products, making it a critical category for profitability. We have serious concerns about the city's proposed ordinance, including a potential change that might broaden it to include all flavored tobacco products. We actually just learned within the past hour that this issue is going to be discussed at a full council work study session tomorrow. Is that correct? If the council is planning to take public testimony tomorrow, then we would respectfully ask that this be rescheduled so that retailers have notice and the opportunity to participate in that meeting. According to the city's survey that was conducted on this topic, the public is not in favor of a flavor ban. The survey, in my view, is very one-sided in how it was drafted, and it did not capture the business perspective or business impacts of the proposed ordinance. But nonetheless, the survey results showed a strong resistance to a flavor ban. When asked, do you support a ban on flavored vaping products in the city of Tempe, 64% of respondents said no. When asked, do you support a ban on all flavored tobacco products, including menthol cigarettes, even more, 64.9% of respondents said no. In contrast, when asked, do you support defining the minimum age for purchase of tobacco products at 21, 78% of respondents said yes. During our industry stakeholder meeting, there were a lot of issues raised by law enforcement, including issues about how the proposal will impact them. There haven't been studies yet to understand the cost of administering the licensing or other components of enforcing the program. And city staff has not identified what the loss of tax revenue from these banned products would be. For C-store owners, the flavor ban is going to mean that their customers are going to buy preferred flavored products at their competitors' shop in neighboring cities or on tribal lands, or even worse, through illicit markets. If drivers stop outside of Tempe for flavored products, they're also going to buy their fuel and associated items like snacks and drinks there. We would ask that the City Council please work with your community retailers towards a statewide solution to address underage access to vapor and tobacco retailer licensing. And that's it. Thank you for your time and consideration.
Thank you. Our next speaker is Brianna Miller. Brianna, you are unmuted. Please make your comment.
Thank you, and good afternoon, council members. My name is Brianna Miller. I'm the health policy specialist at Children's Action Alliance and a Valley resident. Again, thank you for the opportunity to speak today. Children's Action Alliance works directly with communities that are most impacted by pervasive health inequities. Our goal is to realize an Arizona where all children can thrive. You will no doubt hear from today, and you've probably already heard and will continue to hear from health, education, and youth service organizations, community advocacy organizations, youth, and Tempe voters themselves who passionately do support a ban of all flavored tobacco products in Tempe. In fact, when polled, 61% of Tempe residents were in support of such an ordinance. And so as an organization concerned with the health and well-being of children in Arizona, Children's Action Alliance supports, again, a comprehensive ban on the sale of all flavored tobacco products, cigarettes, e-cigarettes, cigars, mini cigars, the endless list of products that contain flavors that we know are specifically designed to hook kids. So while e-cigarettes do pose, of course, a significant threat to Arizona's kids, we know 1 in 6 high school students report using e-cigarettes and started because of flavors. It's not just e-cigarettes. Over half of youth smokers aged 12 to 17 also report using menthol cigarettes, including 7 out of 10 African-American youth smokers. So it's our position that all flavored tobacco products pose a danger to Tempe's kids. Tobacco companies, as we know, are formidable public health opponents, prioritizing profit over the health and safety of everyday people with a demonstrated history of targeting kids in lower socioeconomic neighborhoods and communities of color through the concentration of neighborhood retail shops. Tempe is no exception. Over 50% of Tempe's current tobacco retailers that were inspected since 2015 had a violation for selling products to youth, and over 25% of Tempe's retailers are within 1,300 feet of a K-12 school. So while you will hear talk of tax revenue loss as a potential consequence of enacting this sort of an ordinance, a flavored tobacco ban could result in tremendous long-term healthcare savings. Smoking-related illness costs Arizona $2.3 billion each year. So as leaders in this community, in your community, you're represented with a clear choice. I know no vote is being taken today, but you can choose to side with an industry we know has lied for decades to preserve their profit margins, or you can choose to listen to the voices of physicians, scientists, healthcare leaders, children's advocates. You can choose to vote for the future and to take bold action to stop big tobacco from poisoning a new generation. So Children's Action Alliance urges the council to join the hundreds of communities across the country to pave the way for a healthier Arizona by supporting the strongest and broadest ordinance that will end the sale of all flavored tobacco and e-cigarette products with no exception and establish a robust retail license. Thank you.
Thanks. Our next speaker is Jason Bartlett. Jason, you are unmuted.
Good afternoon, guys. Thank you for having me. Just wanted to point out a couple things. The 2018 data leveraged by the Arizona Department of Health is being leveraged on the poll. That data is adequate. It's inadequate. It's old and outdated. The 2022 data is contrary to all the information. The woman prior to me just noted that the poll that was listed was 61% for Tempe flavor ban. I'm on the tempe.gov website right now. It is 64% no, 33% yes for a flavor ban. Just wanted to point out some inaccuracies. No one's here saying children should have flavored vape. It is illegal. It's 18 by law in Arizona. The C-stores, the small businesses, the gas stations, the pharmacies are selling them at 21 and over by the federal guidelines, which is actually just an interstate guideline requirement. So everyone has taken the time and effort to enforce on themselves, because there's no enforcement available in the state currently, unless there's 2 cities that have 21. I apologize, and there may be a third that do have 21 and over. But everyone's taking it upon themselves to do the right thing and limit access to youth. That's not a question. If you're worried about youth health, we have alcohol consumption in 20 to 30% in the demographic ranges of youth that are illegally accessing flavored alcohol. This ordinance is not covering all flavored tobacco products, because every single cigarette manufactured has different flavonoids and MAOIs. You haven't done your research and studying. They have strawberry flavoring, they have chocolate, they have mint flavor in every cigarette. The products have flavoring with or without it. Marijuana cartridges are not natural. They are flavored with terpene flavoring, natural and artificial flavoring. Girl Scout cookie, Samoa cookie. Vapor products are a wide, broad task for adults. You guys just passed laws allowing marijuana consumption for all adults. It's regulated. It needs to continue to be regulated. I believe everyone's doing a wonderful job doing that. There are people, though, that are buying and handing them to children. Does the law cover that, them going to Chandler and bringing them in a backpack and selling them to kids? No. So then you need to enforce that way. You need to enforce with T21 saying, hey, we already agree that 21 and over, the stores are already doing it. Everybody on this call, you don't have to. It's not the law in this state, in this city for 21 and over. It's 18. We've enlisted to do it. Everyone's doing it. I don't see it happening. I do see handoffs. I do see string purchases happening. And to cover the notes that people are going to talk about, the Avali injuries, if you go look up the studies and the data, the swabbed lung liquid comes back with vitamin E acetate. They had lipid pneumonia, not from water-based products and nicotine products. Those came from the illicit drug market. Every manufacturer who was manufacturing a marijuana diluent, a terpene diluent, that was making vitamin E acetate has disappeared because they
Mr.
knew
Bartlett,
they were
can you
killing
please
people.
wrap up your remarks?
So those are all gone. So that covers that the note that people are going to come at with objections on, and the science shows it's 95% plus healthier. So we're dealing with a combustible cigarette issue, not a vapor product issue from a health standpoint. It's how the delivery of nicotine is happening.
Mr.
and
Bartlett,
keeping
we
it
are
on
at time.
All right, thank you guys.
Thank you. Our next speaker will be Roderick Hurdle. Roderick, if you're on the line, please make it known on the chat. All right, moving on to the next name, Kenja Hassan. Kenja, you are unmuted.
Okay, thank you so much. Thank you so much for hosting this conversation today and giving many of us a chance to speak. I speak today on behalf of the National Coalition of 100 Black Women, whose purpose is to improve the lives of Black women and girls, especially in the area of health, economic development, education, and civic engagement. I speak today as someone who smoked cigarettes for many years and was exposed to tobacco smoke throughout my childhood from every single adult in my life, all of my grandparents, all of my aunts and uncles, my own parents. I've lost two grandfathers to smoking related illness. My grandmother suffered a stroke which, as you know, happens in much higher frequency from smokers, among smokers. My aunt is currently in remission for stage 4 lung cancer. So I fully understand the dangers of smoking, and what we are peddling in here, no matter what the delivery method is, whether it's combustible cigarettes or flavors, it is nicotine addiction. And nicotine addiction is harmful to youth. Youth are exposed at early ages, even if we're selling to 18-year-old or 21-year-old adults. It's creating an environment where young people are exposed to secondhand smoke, secondhand vaping, and making it possible and more likely for them to become addicted to these chemicals and start smoking themselves, especially with things that are wonderfully flavored like strawberry and vanilla. We know from the CDC that tobacco companies have marketed heavily in Black communities, and that about 85% of Blacks who smoke menthol cigarettes. About 58% of American youth who are aged 12 to 17 smoke menthol cigarettes. We know that those flavors hook kids. We know that they're heavily marketed in Black, brown, and poor communities, and that as a city as well positioned to lead the nation on all kinds of decisions as Tempe is, I applaud you for entertaining this conversation, and I encourage you to include all flavored products in the ordinance. Thank you for allowing me to speak.
Thank you. All right, our next speaker is Paul Yuan. Paul, you are unmuted.
Good afternoon, council members. Thank you for the opportunity to provide comments today on this important issue. My name is Paul Yulin. I serve as the chair of ABEC, the Arizona Business Education Coalition, a statewide organization of business and education leaders advocating for K-12 education. ABEC, along with Kyrene Elementary, Tempe Elementary, and Tempe Union, support this ordinance and strongly encourage the council to include all flavored tobacco products. These educational organizations and business leaders understand students are one of the most precious resources and deserve to be protected from big tobacco. Make no mistake, vaping and flavored tobacco products are designed to hook and addict customers. Flavors like cotton candy and Captain Crunch are fancy names to entice kids to use a dangerous and addictive product, creating a future customer base for other tobacco products. It is important to stop kids from using before kids start smoking. Studies have shown early education and awareness is an important step to prevent tobacco addiction. ABEC, Tempe L, Kyrene L, and Tempe Union urge the council to support a strong ordinance to ban the sale of all flavored tobaccos. It's an important step for Tempe to show leadership and be strong in this effort. Thank you. Thank you for your time.
Thank you. Our next speaker is Charlie Moses. Charlie, could you make yourself known in the chat?
Okay,
If you were on the...
I got to listen, but I'm done.
So it looks like Charlie is not with us, and let me mute Paul. There we go. Charlie, okay, anybody that I skip over, I will try again just to make sure that we get all of our voices heard for those of us who are on the call. Floyd Galloway is our next speaker. Floyd, you are unmuted.
Good afternoon. Thank you, council members and staff. My name is Floyd Alvin Galloway, a Tempe resident and a longtime community servant that has worked with numerous organizations, especially those that are dedicated to the well-being of children, including Tobacco-Free Kids, the East Valley NAACP. I'm a former longtime Boy Scout and Cub Scout leader. I urge the Human Services and Safety Committee to recommend to the full council to adopt a tobacco ordinance that includes all flavored tobacco products, including menthol, with no exceptions. It must be comprehensive and complete. Tempe has gone from a conservative sundown town to the most progressive city in the state, and it is important to keep on that progressive track for the health and well-being of all residents. Failure to enact a comprehensive tobacco ordinance, to me, is an insult to the Black community, a Black community that has been the subject to intense campaign for decades by tobacco companies to use menthol products and damage the health of their families and community. For instance, my sister, who has never smoked or drank, but her husband of 40 years was a cigarette smoker, and he used menthol cigarettes, and she is now battling with cancer. 85% of menthol cigarettes are used by the black smokers, and this is a sinister campaign to profit on the lives of Black people. It is an insult to the health and well-being of our children who are being recruited by the tobacco industry to use their poison to damage their health for a lifetime. Just the other day, a few days ago, I was driving down Hardy and I see two kids, one Black, the other either Hispanic or white, and they were vaping. And I knew they couldn't have been no more than 12 years old. Not having a strong ordinance that includes all flavored tobacco products ignores the science of the public health and long-standing issues of social justice. Half of the youth who have ever smoked initiated their smoking habit with menthol cigarettes. Most adults who smoke started as a youth. Flavored cigars are one of the fastest growing products among kids. 50% Hispanic smokers use menthol cigarettes compared to 29% of white smokers, with most starting out as a youth. Now, I urge the Human Services and Safety Committee to recommend to City Council the strongest ordinance that will take care of this problem that is doing damage to not only our children, but our community as a whole. Having a loophole for some flavored tobaccos would simply provide an opportunity for big tobacco, the local retailers, and who are part of a cartel, to redirect sales and marketing efforts and drive kids, especially in the Black and brown communities, to those flavored tobacco products that remain on the market. 54% of Tempe tobacco retailers have been cited for tobacco sales violation, including sales to kids. Most of them cited several times. To have a real and positive impact, the flavors ordinance needs to include strong enforcement provisions with a tobacco retail license requirement.
Sir, can you wrap up your remarks, please?
Okay, thank you. And regular compliance checks and hold retailers accountable. Thank you very much.
Thank you. Our next speaker is Rami Abdin. Rami, I dropped a line in the chat. If you could drop a line just to let me know so that I can unmute you if you are on the call. I'm going to move on to the next name on my list then. That's going to be Amanda Wheeler. Amanda, you are unmuted.
Thank you. My name is Amanda Wheeler, and I'm the Executive Director of the Arizona Smoke-Free Business Alliance. Breaking cigarettes is not easy. I had cancer and still couldn't quit. It wasn't until I found vaping that I found a way to finally break my habit. A post-cigarette world is a reality for millions of adults, thousands of whom live right here in Arizona. But don't take my word for it. I can show you a decade worth of quantitative studies and peer-reviewed research that affirms what I learned through personal experience. Vaping helps adults quit cigarettes, and flavored vape products keep adults from going back to combustible tobacco. The reason that vaping comes in flavors is simple. It is because adults prefer something that tastes better than the cigarettes they are fighting so hard to quit. That's why almost no adults choose tobacco flavor when they purchase vaping products. None of my members are producing flavored products in the hopes of selling them to teenagers. We don't even allow teens into our stores. Our customers are adults, and we are trying to make products based on what they tell us they like. Recently, researchers at the University of California, Davis found that municipal flavor bans do not work, and researchers at Penn State confirmed that e-cigarette or vape devices can result in a reduction of self-reported cigarette use and dependence. The University of California, Davis also said that the efficacy of flavor bans in several California cities don't work. In fact, those flavor bans tend to drive up youth cigarette smoking. Just 4 days before UC Davis put out their study, Penn State researchers also published their findings. And let me read to you their comments. Quote, vape devices may help people decrease their dependence on combustible cigarettes, which contain an array of harmful chemicals called toxicants, without increasing their overall nicotine dependence. UC Davis and Penn State's findings alone should crystallize your opposition to a flavor ban. Adults need vape products to quit cigarettes, and flavor bans do not change youth behavior. In addition, the proposal before you contains a significant flaw. Banning the sale of flavored vape products while leaving flavored tobacco products on the shelf will only drive more adults to the deadly clutches of a pack of cancer-causing cigarettes. Let's be better than giving tobacco another win. I have been an advocate for vaping for more than a decade. I have testified and spoken with lawmakers who were promised by powerful global health advocates and prominent billionaire activists that bans are the only option. The outdated thinking driving organizations such as the Campaign for Tobacco-Free Kids makes them relics. These organizations, bankrolled by billionaires like Michael Bloomberg, are trying to retroactively fight the scourge of cigarettes by imposing the public policy today that they wish they had confronted big tobacco with 50 years ago. A solution to curbing and stopping tobacco use is first not to ban the most effective cigarette cessation device adults have available, a vape product or an e-cigarette. The vape shop model works. Unlike a convenience store or a student's contemporary who makes the purchase, vape shops strictly check IDs. Only adults make it in the door. These storefronts resemble a clinic where people learn how to break the cycle of addiction. A personal relationship exists between the vape shop clerk and the adult customer. Many vape shop operators call their customers clients because they are helping them tailor a specific vape product with a preferred flavor that keeps them from resorting back to the deadly fix that comes from tobacco addiction. I'd also like to raise an important issue concerning social justice. An unintended consequence of flavor bans is the unnecessary creation of conflict between law enforcement asked to enforce the ban and the community of vape product users who overwhelmingly are from low-income, limited privileged backgrounds. And in a recent meeting, we did hear from Arizona law enforcement who had several good reasons to question this policy. In summary, flavor bans are well-intended, but they are not effective. The proposed ordinance...
Please take this opportunity to wrap up your remarks. Thank you.
The proposed ordinance is flawed because it promotes the sale of flavored tobacco. A decade of dedicated study and research confirms that harm reduction is a far more effective public policy than prohibition. Thank you.
Thank you very much. Our next speaker is Jose Hernandez.
Good afternoon, council members. My name is Jose Hernandez. I'm a resident of Tempe, and I'm here to share my feedback on the flavored tobacco products. I used to work at a convenience store here in Tempe where flavored tobacco products were sold. From day one, I was always instructed to check IDs for customers who were purchasing this tobacco products. And I was constantly monitored throughout my shift via cameras by managers and the owners of the convenience store to make sure that I was checking IDs throughout my whole shift. There are a few questions that come to mind when reviewing the proposal banning this flavored tobacco products. And the first question that I have, does the city or parents have enough evidence that these products that are falling into the hands of minors are being purchased within our local stores? Like, is there enough data they can reflect that? And then have the parents trace their kids' online transactions on like Cash App, Apple Pay, and their bank statements to see if they reflect any purchases of products or flavored tobacco products from local smoke shops? Just to keep in mind, anyone can go online and purchase any tobacco product on websites such as Alibaba.com without any ID or anything. The other question that comes to mind is, what conversations are the parents having with their kids regarding this product? I believe that parents should take ownership of educating their kids and have open conversations on why their kids should not consume these products before they are 21 years old. And the other question is, if the city does decide to move forward with this ban, does the city have a plan on de-escalating the sales of these products? And is there a financial support mechanism for these businesses who took out business loans to operate or start their business? And lastly, I think that there's a little bit more to the story where we have to work together as a community to prevent kids from wanting to use these products. It all starts within the household by gaining your kids' trust and creating a safe space for open conversations about these products. The second step is for parents to take ownership of figuring out how their kids are coming up with the money to buy these products and tracing those transactions and reporting any businesses who sold these products to their kids. Plus, finding out if your kids are buying fake IDs from online websites. The focus should be on good parenting, good school programs, and not closing businesses that are legitimate, especially businesses who are creating jobs within our community. Thank you so much. Have a good day.
Thank you. I see that Roderick has joined us. So Roderick, I'm going to unmute you. Thank you for your patience.
My apologies. I was on a call with National Science Foundation. So I will tell you this, I'm the only person on this call who worked at the world headquarters of Philip Morris between 1999 and 2002. I'm going to talk about the truth. So I'm not going to play the game of false equivalence. And we all know that everything starts with parenting. So that's a given. So let's say this, if you are honestly saying that, do we officially know that if there are kids who are underage purchasing these products, that's like saying, do we officially know anybody's going over the speed limit? You're insulting everybody's intelligence. I've worked at the middle of I answered every email that came to philipmorris.com before I was even legally old enough to drink. I know what it is. What you're doing is this, you're putting kids' lives at risk. And also for Tempe, which is the city that boasts we're the young, vibrant city of the Valley, what you're doing is you're cutting off your own pipeline. You're actually saying that this is a product and this is a use that is also affiliated with high school dropout, teenage pregnancy, and the list could go on and on. So we need to quit playing the games. Let's quit mincing words. I've been at the belly of the beast. Nobody else on this call, I promise you, has had much experience. If Tempe really is serious about its future, and unless you're kowtowing to big tobacco and everyone else, then that's what you're doing. This is a very black and white issue. Let's not make a gray area where it needs not to be, right? So we know that that's happening. Also, and I would like to really enforce this situation. We know that this is a fork in the road for the city of Tempe, right? So we're either really, especially with some of the other proposals that are going on with the city of Tempe, you're either trying to be on a pipeline for a cleaner, healthier environment and an economic decade that's going to come up that's not going to be nice. There is a recession. It's already going on, right? So either you're going to drift towards finding solutions to what's hitting us, or you're going to pass things that are going to allow more of these, let's say, pitfalls that come from the use. We know they're marketing to minorities. We know they're marketing to people underage. So let's all just quit the BS. Let's all be honest about it. If you're here for your own pockets, then you're here for your own pockets. I've been in big tobacco pockets. You're not going to need to lie about it. Just say that's what you're doing. But we all know what there's a right and wrong here. And if there's a gray area that you want to paint to make it easier for your own economic status, then let it be known. But let's know there's a right and wrong. And I'm sure the city of Tempe knows exactly what side it should stand on. Thank you.
Thank you. Our next speaker will be Job Dickinson.
Hi, thank you for having me. Can you hear me okay?
Yes, we can hear you.
All right. Thank you, council and staff, for having us today. I'm Job Dickinson. I'm the president of the Border Security Alliance. The Border Security Alliance still objects to this ordinance as written. This is the fourth time that I've spoke in front of the council or staff, and we believe that there are some issues that still have not been addressed in these meetings that need to be looked at by council. The first is what prohibition brings is an illicit market, and with illicit market has unregulated products. Currently, the flavored vapes that are sold in vape stores are approved by the FDA. When you get into unregulated products, this kind of goes the same as what we're dealing with. We had an opioid epidemic with hydrocodone, Oxycontin prescription drugs that were regulated, but now we're dealing with a fentanyl issue. And those fentanyl pills are coming across the border and they aren't regulated when they're made. And that's why we now have the, one pill can kill, because we don't know how much is in that. The same will go with unregulated vape products. They could have different chemicals, THC, different things that we don't want in the hands of anyone that's using this. The second issue I want to talk about is what comes with a black market. So when you do prohibition, it's been proven there will be a black market. People will bring things into your city that ultimately bring extra crime to your residents. I don't know any drug dealer that's going to ask for identification to see how old someone's going to be, if they're selling them vape or marijuana or anything of that sort. With those issues, you now with this, and I think this was talked about at our stakeholders meeting, one of two as they were separated, that you're going to have a loss of revenue possibly in the city. You don't know what that is. That study has not been done. But ultimately, you're asking the city licensing, the Tempe Police Department, other parts of your city to do more with possibly less. And that model has proven not to work. So again, I feel like out of the 4 times I've spoken, none of these issues have been addressed with the council or with staff. And last, what I want to talk about, the Border Security Alliance, we really try to promote good public policy. And I've testified in many councils across the state, at the state level and at the federal level. And I think we need to get good public policy. You need to have a good process. And during this process so far, and I don't mean to offend anyone, but I don't think there's been a chance where people are able to sit down with the decision makers. I put this as the stakeholder group. They were divided from the two sides. And I know there's a lot of people that wanted to talk, and it was taking a lot of time. However, we didn't get in the room. You know, there could have been a way to maybe elect leaders from each side to get in the room to talk with the decision makers, the council and the staff, and to hear both sides and maybe come up with good compromises. You know, at our stakeholders meeting, I didn't hear anything about this including all flavored tobacco, which I'm now hearing is being included. That never came up. There was no chance for us to have any objection to that. So with that said, I hope you can continue the conversation. I hope that stakeholders are taken into account, and that will conclude my comments for today. Thank you.
Thank you. Our next speaker is Trish Hart. Trish, you are unmuted.
Hello. For the record, my name is Trish Hart, and I'm here today on behalf of the Arizona Food Marketing Alliance. Our members are grocery and convenience store retailers here in Tempe, and as responsible retailers of age-restricted products, we take the responsibility of selling these products extremely seriously. We train our employees to check ID, and we do our best to ensure that only adults over the age of 21 may purchase tobacco and vapor products. We're opposed to a flavor ban of tobacco and vapor products, as prohibition simply does not work. We are very concerned that it will just make these products go to a market where there is no enforcement and where no one is checking IDs. And that is not what any of us in this room want. We want to ensure that youth do not have access to these products. We also are very concerned about the way that the stakeholder process has been handled. There has not been any discussion on how it will affect the retail community. We ask that you take a very serious and hard look at what the cost of this program is going to be to the city of Phoenix. The city of Tempe. No one has been able to give us any information on what the cost of this program is going to be. And so we believe that before this moves forward, we need to be able to have a very good idea of what it's going to cost the city to run this program. And also to make sure that we, the retailers who will be paying for the program, know exactly what those costs are, as we will be paying the fee. We greatly appreciate the opportunity to meet with the members of the staff, and we ask that the stakeholder process continue so that we may be able to come to some positive solutions and make sure that youth do not have access to these products. The last thing that I wanted to mention is we just recently found out that there is an agenda item on the work study session tomorrow. In our stakeholder meetings, we had talked about making sure that everybody was included in all of the upcoming meetings. And to my knowledge, none of the folks that were in our stakeholder meetings were advised of the work study session tomorrow. So we would ask that it be rescheduled so that we can have all of the stakeholders that want to participate be able to participate. And with that, I thank you for the opportunity to speak, and look forward to continuing to working to a positive solution on this issue.
Thank you. Our next speaker is Michelle Rose.
Hello, council members Garland and Navarro. My name is Michelle Rose. I'm speaking on behalf of myself, a Tempe resident and voter. I urge the Tempe Human Services and Community Safety Committee to advance a comprehensive and complete ordinance that includes a ban on all flavored tobacco products, including menthol products. This is about protecting Arizona children. Flavors Took Kids AZ reports that 81% of kids who have used tobacco started with a flavored product, and half of youth who have ever smoked initiated with menthol cigarettes. 1 in 6 Arizona high school students use e-cigarettes. 7 out of 10 youth e-cigarette users cite flavors as a reason they use e-cigarettes. Our communities are in the throes of a public health crisis. According to the Centers for Disease Control, tobacco use causes nearly 500,000 deaths per year. It's the leading preventable cause of death in the United States. So is it any surprise that the profiteers of cancer-causing, cardiovascular disease-causing products don't obey the law? In the past 7 years, 54% of Tempe tobacco retailers have been cited for tobacco sales violations, including sales to kids. Most of them have been cited several times. Retailers must be held accountable through regular compliance checks, strong enforcement provisions, and meaningful penalties. In August 2022, a diverse coalition of 105 organizations sent a joint letter to the Food and Drug Administration urging them to, quote, move forward with ending the sale, production, and distribution of menthol-flavored tobacco products. And they applauded the FBA for ensuring the policy targets the producers and distributors only, in no way that sets up any user penalties. The Tempe City Council has to choose sides now in this war on public health. You will choose whether to finance the tobacco industry's war on public health, which they have waged directly against our children and communities of color, or to stand on the side of public safety and our children. I urge you to choose Tempe children by passing a comprehensive and complete ordinance that includes a ban on all flavored tobacco products, including and especially menthol products, creating an exception for the most popular product, menthol flavored products, knowingly, willfully fails our children. I'd like to thank the Flavors Took Kids Arizona for the data I cited, and thank you to the City Council members for your time and consideration.
Thank you. Our next speaker is Claudia Rodas. Claudia, you are unmuted.
Yes, hi. Good afternoon. Claudia Rodas. I'm with the Campaign for Tobacco-Free Kids. On behalf of the Campaign for Tobacco-Free Kids, I'm here to offer information for the proposed ordinance that establishes a local tobacco retail license, raises the minimum age of sale for all tobacco products to 21, and restricts flavored tobacco products. We ask you today to strengthen the ordinance by including all tobacco products. Once strengthened, the proposed ordinance will help reduce the number of young people who use and become addicted to tobacco products, and ultimately help to reduce the disease and premature death that these products cause. For years, the tobacco industry has enlisted convenience stores as their most important partner to market tobacco products and fight policies that reduce tobacco use, thereby enticing kids to use tobacco and harming the health of our youth and community. In the 2016 report, Deadly Alliance, a report by the Campaign for Tobacco-Free Kids, the American Heart Association, and Counter Tobacco, the evidence demonstrates the close alliance between these two industries. As other forms of tobacco marketing have been restricted, tobacco companies now spend more than 95% of their marketing budget, nearly $8.7 billion a year nationally, to saturate convenience stores, gas stations, and other retail outlets. Arizona sees almost $124 million per year spent on tobacco marketing each year. 3 key findings in the report. Convenience stores and other retail outlets have become far the dominant channel for marketing tobacco products in the United States. Tobacco companies pay stores to ensure that cigarettes and other tobacco products are advertised heavily, displayed prominently, and priced cheaply to appeal to both kids and current tobacco users. Point-of-sale marketing is very effective at reaching kids and influencing them to smoke, with nearly half of the adolescents visiting a convenience store at least once a week. The evidence is clear that point-of-sale marketing and price promotions influence youth initiation, experimentation, and progression to regular smoking. Lastly, tobacco companies enlist convenience stores as front groups to oppose other policies to reduce tobacco use. National partners include Petroleum Marketers Association, the National Association of Tobacco Outlets, and associations of convenience stores. So it's no surprise that many of the state and local affiliated groups are opposing these measures today. In summary, tobacco companies spend billions, with the B, in concert with convenience stores and other retailers to make tobacco attractive, accessible, and affordable, resulting in more kids starting and fewer adults quitting. It is essential for Tempe elected officials to adopt policy to reduce tobacco use and counter the influence of point-of-sale marketing. We ask for your help in preventing youth from starting to use tobacco products by by strengthening the proposed ordinance to include all products, all flavors. Thank you for your time.
Thank you. I appreciate it. We are moving now to folks on the chat who have indicated to me, either to the group or to me privately, that they would like to speak. And I'm going to start with Stephanie Siete. Stephanie, I'm just finding you. You are unmuted.
Thank you for recognizing me in the chat and for the opportunity to speak. Stephanie Siete. I have been an employee of Community Bridges in Mesa, Arizona for over 20 years. We work on behavioral health programming, but I also represent Parents Against Vaping and E-Cigarettes and the Tobacco Free Kids campaign. And as I listen to all these calls and been a part of all of them over the last year, you know, I sit back and think, wow, I've been doing this work for 20 years. I'm not even a parent, right? But I advocate for all of the kids. And I had a meeting the other night with Boy Scouts, and an 11-year-old kid was just listening to me, you know, spit out facts about what's happening with tobacco, how 2.5 million middle school and high school kids are using in the last 30 days, and 85% of the youth, you know, they started with flavors and the things we've listed, the cotton candy, you know, the mango, the chocolate, what have you. And this 11-year-old kid raised his hand and he's like, why do these products exist? And given it was a Boy Scout troop of 11 to 17-year-olds, so I said, what do the older kids think? What's the one word answer? And everyone shouted, money. And I'm like, it's so sad that the older kids already realize that this is all about money. So then we had this really big talk about marketing and manipulation and how it starts so early in this world. And all these little kids are being poisoned by tobacco products. Now, again, been teaching this stuff for 20 years, and my first job was tobacco education right out of college. And I used to say things like 20 years ago, good thing liquid nicotine doesn't exist because one pure drop would be dangerous enough to poison someone. And nowadays it's the #1 seller with kids, and it's a flavor. And so for people to say, oh, well, no, we don't sell this stuff and it's not getting in the hands of kids, again, over 2.5 million kids, and that's just those that are honest enough to say in the survey, and 85% of them started because it tasted good. Most of us grew up in a time where there was limited flavors, and even smokers like my mom knew it was bad. It was highly addictive. They wanted to quit. Why wouldn't we, the city of Tempe, do everything we can to protect these kids, to advocate for them? Again, not even being a parent, all I want to do is get these young brains to not be manipulated, to understand facts and truth so they can make better decisions. Someone needs to inform them. And again, I agree, everyone, yeah, parents should talk to their kids, but a lot of the times parents don't have this information either. And it's not, we got to do everything we can. And if it starts with the city removing a flavor, I even think about a dad on a call who said, you know, my kid is at ASU and she doesn't have a car. She won't be driving to another city to get it. We have got to stand together, remove all flavored tobacco products from the hands of youth. Sure, when we become adult, as I always say, you do you, but let's protect our kids by having Tempe take the lead and remove these poisons from their hands. What I've seen in 20 years is vaping has
You're at time. Can you
expedited.
please wrap up your
Sure.
remarks?
I was just going to say vaping's expedited the damage that smoking did. So let the facts be facts, and thank you for your time.
Thank you. Our next speaker is Emily Hanna.
It's me.
Emily, you are unmuted.
Hi, and I apologize for being a little under the weather, but my name is Emily Hanna. I work with kids across the valley and have seen the issues and challenges with these kids when they use and get hooked on flavored tobacco products. It is important for the city of Tempe to take a stand and protect kids from the evils of tobacco products. Please, please pass an ordinance to stop the sale of all flavored tobacco products. It is a small but very important step to help protect the young from being hooked on a very dangerous and addictive product. Thank you.
Thank you. I'm looking at our chat. The next person on my list is Bernice Carver. Bernice, can you make yourself known on the chat? I'm not sure if you're still on. Bernice Carver. Okay, we'll skip over Bernice and moving on to the next registered speaker or the person on the chat. That is Joseph Yuhas.
Good afternoon, members of council and Tempe staff. Thank you very much. Joe Yuhas with the Campaign for Tobacco-Free Kids. Thank you for this 8th public meeting on this issue over the span of the last 14 months. By the way, your process has been exceptional. You have issued all the proper notices for these meetings, including tomorrow's workshop. So thank you very much for the opportunity to come before you. Over that 14 months, I'm struck by the fact that our opponents to this important measure find more common ground with us than I ever thought. For example, it's been stated that an end to the sale of flavored e-cigarette products would only drive kids to combustible tobacco. We couldn't agree more, which is why in the initial effort by our coalition of 40 community-based organizations, we advocated for a comprehensive flavors ordinance that would include all products. That was included in the first 2 drafts of the ordinance. It's omitted from this draft. We hope that that language will be added back in. And why is that? Because the simple fact of the matter is, as was stated by the opposition, omitting those products will simply allow them to remain on the market, allow the industry to drive kids to those remaining flavored combustible tobacco products, again, hooking them or attracting them initially with flavors, but then hooking them again with nicotine. It's been stated we should use data by the opposition. Couldn't agree more. Here's the data. Out of the 160 tobacco retailers in Tempe, you have data that we have provided that 54% of them have violated the sale of tobacco product regulations over the past 7 years. 54%, 83 of the tobacco retailers in the state, in Tempe. A third of them multiple times. One of them 14 times. Truly outrageous. So when you talk about, is there data that this is being sold to Tempe kids? There's your data, enforcement data. Let's talk about more data. Public opinion. Yes, Tempe, to its credit, did a community survey that was self-participatory. 41% of those who responded, for example, claimed they smoked cigarettes. So there you go right there. That's going to skew the results. The Campaign for Tobacco-Free Kids did a poll, and again, you and your colleagues have this data, that a solid majority, 61% of Tempe voters, favor an ordinance to end the sale of flavored tobacco products that appeal to youth. All products, only 33% opposed. So that's the kind of facts and science, not the fallacies and the misstatements made by the self-serving tobacco industry, that should guide this discussion moving forward. And again, we thank you for the opportunity to come before you today. We urge you to enact the broadest possible comprehensive flavor ordinance that will not only save a generation of Tempe kids from a lifetime of nicotine addiction, but really set the mark for other communities in Arizona to follow. Thank you.
Thank you very much. Our next speaker is Guy Bentley. Guy, you are unmuted.
Good afternoon. Thank you so much for allowing me to speak. My name's Guy Bentley. I'm Director of Consumer Freedom at the Reason Foundation, and we're a 501c3 nonprofit public policy think tank. While we applaud the intentions behind the measure to limit tobacco use, particularly amongst youth, we do fear that such prohibitions, as has been evidenced across the country, do carry severe unintended consequences. And I completely agree with the previous speaker that we should be looking at the most recent and up-to-date data when we look at tobacco use. So according to the 2022 National Youth Tobacco Survey, youth vaping has actually declined by more than 60% in the last 2 years. We also see that youth smoking is at the lowest in a generation, with just 2% of youth having tried a cigarette in the past month or so. But I'd especially like to draw your attention to, as discussions around extending the possible ordinance to all flavored tobacco products might be on the table, to the experience of Massachusetts, which did implement a statewide tobacco flavor ban in June of 2020. And my colleague Jacob Britch, who is currently based out of the Center for Evidence-Based Care and Research at the Cleveland Clinic, conducted an analysis of the ban's impact comparing the year before the ban to the year after the ban. And what we found is that there was a net increase in cigarette sales of 7.2 million packs within Massachusetts and its bordering states. Massachusetts also saw an increase of 15.6 million non-menthol cigarette sales packs, and the state lost around $125 million in tobacco revenue. And a report from the Multi-Agency Illegal Task Force on Tobacco reveals that state police and Department of Revenue seized more than 5,000 packs of illicit cigarettes and more than 100,000 vapor products. Also, regarding whether a comprehensive tobacco flavor ban would reduce youth use, it should be noted that Yale University's Abigail Friedman did conduct a study of the city of San Francisco, which did implement a comprehensive ban on flavored tobacco. Quoting Dr. Friedman, she found that youth within the San Francisco area had double the odds of smoking compared to jurisdictions with no flavor ban. Quote, "While neither smoking cigarettes nor vaping nicotine are safe per se, the bulk of current evidence indicates substantially greater harms from smoking, which is responsible for nearly 1 in 5 adult deaths annually. Even if it is well-intentioned, a law that increases youth smoking poses a threat to public health," said Professor Friedman. "Prohibition doesn't end tobacco, alcohol, or drug use. It simply ends the legal sale of these products." And I will be sending all of this data and relevant facts to the committee. But I'll leave it there, and thank you so much for your time.
Thank you. Our next speaker is Megan Bolter. Megan, you are unmuted.
Addiction Foundation, also known as Tobacco 21. I just wanted to address one glaring discrepancy within the existing draft of the ordinance, and that has to do with compliance checks. As it stands, it looks like it would be a complaint-based protocol in which someone would witness an underage buy. And in this case, best practices and evidence-based research indicates that a proactive approach in which there are annual, 2, if at minimum 2, but at least 1, annual mandatory compliance checks are the most effective in increasing retailer not only awareness of compliance measures, but also compliance in terms of keeping these tobacco products out of the hands of youth. And I keep hearing about cost. The cost of a reactive program includes both the courts, law enforcement officials, and taking documents in terms of evidentiary procedure, whereas a proactive solution conducts organized and planned controlled buys, which on average across multiple states and jurisdiction cost less than $100 a piece. So you can see that a proactive compliance enforcement protocol, which would involve either the Department of Health, similar to what's conducted with liquor inspections or food inspections, can be the most efficient and costly and least costly manner of conducting these enforcement checks. Second, I just wanted to address the commentary about the FDA compliance, the federal law being an interstate guideline. There is a federal database that can show that over 95 of the citations, some including multiple citations for a single tobacco retailer, include civil penalties, no tobacco sales orders, as well as warning letters issued. So federal law is not a suggestion. Simply because Arizona has not adopted a T21 policy does not mean that retailers can choose to be compliant with federal law. I also wanted to mention that when you hear opponents suggesting a statewide solution, which has an interesting ring to it, this is also code for removing Tempe's grounded authority to enact policies that protect its constituents within its own boundaries. It disrespects your autonomy and it is endorsement for preemption, which has been explicitly stated by tobacco industry advocates as a means to increase retail sales, because without local control, there is much less likely oversight with respect to sales to youth and adulterated products. I just want to also mention that in terms of Tempe's progressive nature, Tempe Union School District has been chosen as a class action representative among 5 other districts in the nation to represent school districts with the burdens that they have been borne with respect to the predatory marketing strategies that are born at the point of sale at retailers. And I quote, the significant, can you hear me okay? I keep hearing background. Are you okay to hear me? Can you hear me?
We can hear you, and if you could please wrap up your remarks.
I will.
Thank you.
The Tempe Union High School lawsuit, alleges that these predatory point of sale tactics force school districts to expend significant resources to combat defendants, including manufacturer, retailers, and high-end sellers' deceptive marketing schemes to educate students on the dangers, the true dangers of e-cigarette use, as well as prevent possession of these products on campus. And if that progression continues, this ordinance will help those schools to recoup some of the costs. And when you talk about the burden, think about the healthcare burden that the city and the state will bear if a flavors ordinance is not enacted. Thank you for taking my comments. I appreciate your time.
Thank you. Our next speaker will be Bernice Carver. Bernice, you are unmuted.
Okay, thank you. My name is Bernice Carver. I live in Flagstaff, and I have family in the valley there. My parents were addicted to tobacco. They both died before I was 17 years old. As kids, we were always sick from breathing secondhand smoke, and my 13-year-old brother actually died from bronchial pneumonia after going to the hospital, and we couldn't get away from the smoke. A lot of people that vape around their kids, they vape in the cars. When my husband was 42 years old, he was working in a place that had secondhand smoke, and he ended up with lung cancer. And he died a very gruesome death. That was the day before my son's 16th birthday. And I had a 14-year-old daughter at the time also. So, and after they watched their dad die a very gruesome death, they began smoking. And both of them smoked Camels because that was the main advertised brand at that time with kids. And my son used to have no problem in buying cigarettes at convenience stores that were right next to the high school that he attended. It was one of the high schools that he attended because he kept getting expelled because he was addicted to nicotine and could not stop. I went on to be a tobacco cessation specialist for the state of Arizona, and I'm a retired health educator. I've spent a lot of my time trying to help people quit smoking. I've helped thousands of people quit smoking in my career. I do anything I can to help people quit smoking and vaping. One of the things that I have found is that vaping can be as or more addicted than smoking because you can get more nicotine more quickly, and a lot of people will take their vapes into places they do not allow smoking, and they will take hits off of it in bathrooms and places that are not supposed to have any smoking. We have an epidemic addiction in our state. Every single city is affected by it. Big Tobacco is sugarcoating their products to pump up their sales and hook children into this lifelong addiction to their harmful product. They say their products are necessary to help smokers quit. That, to me, is a big fallacy. If they quit nicotine, Big Tobacco would lose money, and these retailers would lose money. And it's the money that they are most concerned about, not the health and lives of our children and the citizens of our state. I really would like to ask these people if they could sell another product that doesn't kill people and addict children, maybe, we could have a much better conversation about helping people to have healthier, stronger lives. I urge the Human Services and Community Safety Committee and the Tempe Mayor and Council to pass a strong health ordinance regulating and licensing the sale of tobacco products, to include banning the sale of flavored tobacco, including menthol, and protect the public health and safety of the future and the future of our families. You will again be a health leader of your community and of our entire state. I would also like to say that my sister committed suicide. She was addicted to 4 packs a day of cigarettes that she started when she was 13.
Ma'am,
She
we
was
are out of time.
also,
Can you please wrap up your
okay.
remarks?
Anyway, she couldn't pay her rent because she was spending all her money on tobacco and ended up killing herself. And that was about 10 years ago. So it's getting worse now. And I'm so proud of you guys for doing something about it to make it better. Thank you.
Thank you. I'd like to call on Sharon Doyle.
Hi, I just have a few comments. I'm part of the Tempe Coalition that tries to prevent kids from starting any kind of habits that would be adverse to their growth and their educations. But I guess listening to everybody speaking, it boils down to it's money or it's kids. It's money or it's health. It's future addiction versus a healthy lifestyle. And I know the city of Tempe values its citizens, values its kids, does a lot of things to try to promote healthy communities. And this is one more step that I hope that City Council will take, banning all flavored tobaccos. The money that is being brought to retailers for flavored tobaccos, for the majority of those retailers, this is not the money that will make a difference, not much of a difference for them. But children, harming their health will be a lifelong problem for them. So I think it's a clear choice. It is the health of our children, who are going to be our young adults and then our citizens, versus putting more money in the pockets of retailers. Thank you.
All right, our next speaker is going to be Graham Matthews.
Hi, can you hear me?
Yes, we can hear you.
Hey.
Okay, thanks. Greetings to everyone in attendance. I am Graham Matthews. I have lived in Tempe for over 20 years. I went to ASU and I'm a local business owner. What will be the outcome of a flavored vape ban? Pray that we never see a flavored vape ban. Picture a loved one wrapped in bandages, a loved one incoherent from the amount of drugs pumped into them, a loved one in unimaginable, intense pain. This is one of the most horrible experiences of life. This is the reality of cancer. Not all forms of cancer can be prevented. However, cancer deaths from smoking tobacco are way too common in the United States. The CDC states that cancer caused by tobacco usage make up an astounding 40% of all cancers diagnosed in the United States. Sadly, these deaths are entirely preventable. A vote for the flavor ban is a vote for cancer. A flavor ban is in fact a tobacco mandate, which in effect is a cancer mandate. A flavor ban forces adult vape consumers to smoke tobacco-flavored vape or return to traditional cigarettes. This flavor ban will lead to large amounts of adults going down the archaic path of traditional cigarette smoking, and thus a guaranteed path to cancer for many of them. As the Surgeon General warns, cigarette smoking is deadly, dangerous, cancerous, and hazardous to your health. I do not personally vape. However, since I was a child being trapped in elevators, bathrooms, and smoke-filled cars, I have felt impassioned to remove cigarettes from the market and prevent the harmful, deadly effects of tobacco products. I do not vape. I will probably never vape in my lifetime. Regardless of my personal choices, it is still a proven fact that vape flavors save lives and extinguish the dirty, smelling, metaphorical butt of nasty chemical cancerous tobacco smoke forever. Remember that vaping flavors does not mean vaping nicotine. There is vape juice that contains zero nicotine in it. This is because the best way for traditional smokers to overcome nicotine addiction is to gradually reduce their nicotine consumption by scaling back nicotine content until they finally get down to 0% and simply enjoy the delicious flavors or stop vaping entirely. Tobacco vape flavoring is a harbinger to quitting nicotine, as traditional cigarettes always have nicotine, so 0% tobacco flavored vapes sell dramatically less than 0% flavored vapes. Let us be clear, this is not about kids and youths. This is the punishment of adults. This will shorten the lives of adults currently vaping flavors by converting them to traditional cigarette smoking, depriving them of the path to quitting. The path of quitting smoking is vaping and reducing nicotine consumption. There were tons of gimmicks like nicotine gum, patches, and fly-by-night solutions that never worked until flavored vaping came out and revolutionized the process of quitting smoking. The world we live in today is dramatically different than the world of the past. Modern technology allows vape users to use a heating element to produce vapor and consume natural substances.
We are at
Flavored vape
time.
ju-
Please wrap up your remarks.
Anyway, vape is made of PG, pipeline glycol, vegetable glycerin, natural flavors, and sometimes nicotine. That's it. It's not harmful like cigarette smoking. Let's not go backwards to the harmful world of secondhand smoke that kills people that don't even smoke. Let's move forward to delicious flavors and
We are
vape
at
that
time.
does not harm others. Thank you for your
Thank you.
time.
Thank you. All right, Ted, you are up next. Ted, you're
Can you hear me?
Yes, we can.
Hello, thank you. My name is Ted Kircher. And first thing I'd like to say is currently all flavors are illegal for kids. All tobacco products for those underage are illegal for purchase at this time. If this ordinance goes through, it will only make the products illegal for adults to purchase them in Tempe from Tempe businesses. So I realize in a utopian world, in the Camelot, wishful thinking, there'd be no tobacco, there'd be no alcohol, there'd be no crime. But the reality is 20% of the population enjoys nicotine. It's a stimulant. Unfortunately, the cancer-causing chemicals in cigarettes that are unlisted, cigarettes, remember, do not have ingredients on the side of the packages. Vape products, they do have the ingredients listed. They have a measured nicotine level on the side of the products. And a lot of people prefer these because they know what's in it. They know harmful chemicals are not in it. They can try a product that gives them the satisfaction with a measured known amount of nicotine. And a lot of customers use that and they reduce their nicotine level over time. And a lot of them go down to zero. Some people even vape zero just so that they have a cessation device that mimics a cigarette without delivering the harmful chemicals and the addictive nicotine that they're trying to get off of. Now, this law, this ordinance that's proposed, like I said, it will only affect adults and their choice because it is already illegal for those underage. Let's remember that. This is a law that is just going to affect adults. They keep saying the kids. It is already illegal for kids. And I understand the concern. I have 2 teenage kids and no one wants kids to get these products. It's bad for the kids themselves. It's bad for businesses that if they get it from them, it's bad for the manufacturers. And, a lot of people compare the bans to the failed bans of alcohol and talk about advertising and marketing to kids. Alcohol advertising is everywhere. And even from the CDC website itself, while people that smoke and use nicotine products, they live on average 10 years less than people that don't smoke. People that do alcohol on a regular basis, their life can be reduced on average of 26 years. That's from the CDC, and I will mail you copies of those records. But we're not talking about banning alcohol. We're not talking about banning drugs, even though now marijuana is legal, recreational. And it's like for 21 and over, just like alcohol, we know the ban on alcohol didn't work. We know the ban on weed didn't work. Now it's regulated and it's, being tracked and it's taxed and it's monitored and it's safe. But if we make these products, if this ordinance proposes illegal, it'll create a black market. Then we'll have unhealthy options. There'll be more crime, as stated before. It'll push people back to cigarettes, the worst option. This is crazy that we're banning the less harmful option and going back to the more harmful option. If you want to be progressive, let's look forward and encourage people to get off the old cigarettes and go to a less harmful method that lots and lots of doctors say, hey, this is less harmful. Health ministers in other countries are even encouraging their citizens to switch. That would be a more progressive thing. Raising the age of 21 makes sense. A tobacco license makes sense because then you could take away the license from those shops that still break the law.
Please wrap up
This
your
ordinance,
remarks.
yes, this ordinance will only help those willing to break the law make more money, and it'll force people outside of Tempe, and kids will still get these products even if this ordinance goes through. Thank you for your time. Have a good day.
Thank you. And Charlie Moses, you're our next and I believe last speaker since we've given a notice on the chat.
Thank you. Can you hear me?
Yes, we can hear you.
Wonderful. All right. Well, hi, everyone. For the record, my name's Charlie Moses. I'm an epidemiology and public health doctoral student and researcher. And today I'm writing on behalf or speaking on behalf of Parents Against Vaping E-Cigarettes. We're a national organization with volunteers all around the country, including here in Tempe. And we fully support eliminating the sales of all flavored e-cigarettes, menthol cigarettes, and all other flavored tobacco products that are targeted to youth in all locations. The stress put on families as a result of the youth vaping epidemic is enormous. Working with parents and seeing so many scared for the health of their kids, it's incredibly distressing seeing it on a moment-by-moment daily basis. Navigating the terrain of youth becoming addicted to nicotine is exhausting, and it's clear that big tobacco continues to target youth. Print ads in corner store windows using young models, literal paid advertisements on Cartoon Network and Nickelodeon, targeted social media campaigns using young influencers, and we know that big tobacco owns large majorities of vaping companies. The results of these efforts are once promising futures being derailed by substances. We care deeply about small businesses in Tempe, and we believe that this is not the way to make money. No one should be depending on a business model that addicts youth. And it's time we join together to help youth, help parents, help families, reduce current and future negative health impacts that burden all of us. So please take a leadership position in Arizona and join with the over 335 localities across the country that have restricted the sale of flavored tobacco products. Please support a comprehensive ordinance to end the sales of all flavored e-cigarettes, menthol cigarettes, and all other flavored tobacco products, so clearly targeting our children in all locations. Thank you so much for your time.
All right, thank you. I believe that takes us to the end of our public comment period. I want to thank everybody for adhering to the 3-minute rule so we can try to get to what we need to get to at this meeting. We are beyond our limit on time, but we anticipated that. So Councilmember Garland, we can continue on with our agenda items.
All right, I appreciate that. Thank you, Paul, for helping to organize that. And that's a lot of work to do, trying to figure out the timing and looking at the chats and all the other stuff that you were just doing. But I appreciate so much that so many people were able to take the time to let us know what they were thinking and what their positions are. So we just want to say thank you very much for being a part of this process to move this forward. So the next item on our agenda is our community session items, and we have one item on the agenda. The presentation on recommended changes to proposed ordinance to regulate the sale of tobacco through a tobacco seller license within the city of Tempe based on our public input, the input process. So I'd like to welcome Council Aide Paul Smith-Leonard to do our presentation for us.
Hey, thanks so much, Councilmember Garland. This is the presentation that we've been giving to folks, and it's a pleasure to give it before this committee where, a lot of this work on this ordinance began. Just going back, I think maybe did we not put that on this slide, but I guess this is an overview of the public engagement process. We've done this, council members, in accordance with the Tempe Involving the Public Manual, or TIP manual. Included 2 public forums, 2 stakeholder meetings, and an online survey via Tempe Forum. I'd just like to add, the TIP manual calls for at least 1 public forum and 1 stakeholder meetings. For this process, we had 2 of each. And as somebody had mentioned before, the stakeholder meetings, by necessity in our space considerations, was comprised of small business and industry representatives, and then we had parents and health advocates who were attending that second stakeholder meeting. This was last month in November. This is an effort that's led by mayor and council staff, and I'm very honored to take the lead in that, in partnership with the services office. And there's been a lot of staff help throughout this entire process, and for which I personally would like to give thanks for. So these are 2 public forums, as I had mentioned. These were both held on the same day. The first meeting was held via WebEx. A lot of you were attending that meeting, so we thank you for participating. We also had an in-person meeting, and I know that some people on the call also participated in that. We had a great turnout, and we had 34 members of the public speaking at that meeting, 10 opposed, and 24 in favor of the ordinance. So it takes 2 stakeholder meetings, as I mentioned briefly. The first one was held with industry and small business stakeholders. We had participants that included the Arizona Marketing Alliance, AZ Petroleum Marketers Association, NATO, and Tempe small business owners. We had more than a few small business owners, so it was really great to see. Areas of focus that we discussed at the meeting: fees, required education and training, looking at that 36-month timetable for violations. Our second meeting it focused on health advocates, parents, and caregivers, and that was held on November 15th. The participants included American Heart Association, American Lung Association, Campaign for Tobacco-Free Kids, and a member of the NAACP East Valley branch. Our areas of focus on that and that meeting was changing the ordinance language to include all flavored tobacco products targeted to youth and communities of color. So here are the suggestion changes that came out of the industry and small business stakeholder group. So we're looking at adding a 4th violation before license revocation. And we did this in response to business and industry concerns. This additional violation will be added before license revocation. The 36-month timeframe would be kept, but could be shortened to 24 months. We had a requirement to remove tobacco products. So this requirement to remove tobacco products is proposed to be changed only to apply to businesses that have had their licenses revoked. Again, this is in response to concerns about compliance for business owners. So again, that would be only upon revocation of the tobacco sales license. And we clarified the definition of tobacco products. Based on concerns expressed at the stakeholder meeting on the 15th about unintended consequences of this proposed ordinance, we have proposed clarifying the definition of tobacco products and e-cigarettes to not include medical or recreational marijuana. And moving on to suggested changes from our health advocate, parent, and caregiver stakeholder group. The city, as both council members know, has been on the forefront of enacting control policies to combat youth usage of tobacco and setting the bar for communities in the entire state. The most famous example, smoke-free ordinance, was passed in 2004, or took effect in 2004, prohibiting smoking in restaurants and other public places. It was one of the first Arizona cities to do so, and I dare say one of the first in the American Mountain West to do so. In 2014, added e-cigarettes to the smoke-free ordinance, the first city in Arizona, again, to do so. We had some speakers talk about the consequences of excluding some tobacco products. Now, the current wording of our ordinance covers flavored e-products only. So here are the consequences of having just a limited definition of the items that are covered under our ordinance. Menthol cigarette use is highest amongst youth African Americans, and Latinos. We show that half of youth who have ever smoked initiated with menthol cigarettes. 85% of African American smokers and 50% of Hispanic smokers use menthol, compared to 29% of white smokers, with most starting out as youth. Their preference for menthol is also disproportionately high among LGBTQ smokers with mental health problems, socioeconomically disadvantaged populations, and pregnant women. Flavored cigars are one of the fastest growing tobacco products among kids. Sold in over 250 kid-friendly flavors such as grape and banana smash, they're sold in 2-for-1 99-cent packages designed to be affordable for kids. Now, excluding some products will simply provide the opportunity to direct sales and marketing efforts to drive kids to those flavored tobacco products that remain on the market. We have some proposed changes, council members, to the ordinance that would include all flavored tobacco products. And you can see some examples of the changes. We will be making this presentation stack available on the website. It can be found online on the HSCS committee page. And we have some changes here that would allow us to include all flavored tobacco products. Now, not only our stakeholder groups, but city staff had some suggested changes as well. And our suggested change is to reduce enforcement burden on police. The administration and enforcement of proposed ordinance, we're proposing to make a change that will reinforce the idea that the burden of enforcing and administering this ordinance will be shared among city agencies. Now, council member, this is their opportunity to discuss and ask any questions, I believe, of staff on anything that is of me in regards to this presentation today.
Okay, thank you, Paul. So that was 4 different locations that we would need to do the edits that would remove it from just saying vape to all flavored tobacco products.
Yeah, that's subject to review from the city attorney's office, but we've identified, mayor and council staff have identified 4 areas in the ordinance that would need to be changed. Correct.
Joel, do you have any questions?
Yeah, just quickly. When we talk about enforcement, have we thought through all the process of who does the enforcement, the staffing of the enforcement, and is that tied into this conversation tomorrow?
Yes, council member, good question. So conversations have been occurring between PD, Tax and License Division, the larger finance division, the city's attorney's office. We also had code compliance added into that conversation. So the idea was just hearing some concerns about how using or utilizing existing resources, how best to share the responsibilities of administering and enforcing this ordinance, and just changing this language so that it's clear that city agencies will cooperate on this. There's some limitations that came up as part of this conversation. So tax and license personnel in particular, they are not allowed to enter an establishment. So there's going to be some ongoing discussion and a proposed delayed effective date for the ordinance to allow some of these discussions between agencies to move forward, so that it's very clear where the responsibilities break down among them.
Got it. So yeah, I think we definitely got to get that cleaned up for sure. Now, as I understand, tomorrow we go to a work study, but then this has to be posted for like 60 days, which means that with the process of this whole deal before it goes to a formal meeting, if there's no changes or whatnot from the work study, you're probably looking something in March. Is that what I'm speculating?
We've identified February, but it could very well be depending on the regular council meeting schedule. This is all presuming that the committee of the whole has, gets a consensus to move forward with the ordinance in terms of posting on the website. And you are correct, it will be for a period of 60 days. The fees will be posted on the website. Also, the cost analysis. This is the cost of the city, the cost to administer and enforce the program. That will be posted alongside that. That's my information. So yeah, Councilmember Navarro, that a March date is certainly possible, but we were thinking that it could possibly go. This is all just accounting for or just waiting for the determination by the COW to move forward.
And I just want to let everybody know, I mean, this conversation literally has been going on for over a year. And I know that people have been engaged. I know that both sides have been engaged to making sure that they get heard. And, obviously we want the process to be open and fair and transparent as possible. What I can see and understand, and this happens with a lot of meetings, hey, we need more time. Well, we have some time right now. You have tomorrow to be at the work study, to post and voice your concerns at that work study. The committee of the whole will be listening to it and asking a ton of questions as we go through this process. This is not an easy process, if you can imagine. So I know that with that process being set, and then the timeline for this, we have other opportunities, even possibly to have the possible for outreach or discussion on this thing for more feedback, and that could very well be by individual council members. So I hope that everyone gets a clear message that please stay tuned. Please watch any information from the city of Tempe, and please visit our website, because if this is an important matter to you, please stay engaged, because often, and very too often, we go through these situations and we often get people are just finding out for the first time. And with this conversation and topic, I just want everyone to be clear, this has been going on for a long time. So please stay engaged, as we want our community to stay engaged. And we want to make sure that everybody is heard. So thank you for the speakers who spoke today, sharing their information. It was very enlightening, and I appreciate your thoughts and making sure that all information is weighed. And I want to thank everyone for being here. Thank you.
Thank you, Joel. And I will echo exactly what he said. I appreciate the time that people took, and there will be opportunities for people to examine what we have are going to be putting together. Moving forward, there are still other steps for us to take on this. But for today, there are 4 items that, Joel, we need to have consensus on to move this forward for our work study session tomorrow. So, Paul, are you okay if I go ahead and move on to this? You don't have any other things for us?
No, I don't. We can move on to items for consensus, Councilmember.
Okay. All right, the first item for consensus is to include all of the changes to the draft ordinance based on the public outreach and input. Joel, are you okay with us moving forward? Joel?
Sorry. Yes.
That's all right. Okay, yes, that was a yes from Joel. Okay, the second one is to recommend that new draft of an ordinance move forward to review by the committee of the whole based on recently completed public engagement process. Are you okay with that, Joel?
Yes.
Okay, so am I. The third one is examine ways to decrease administrative and enforcement costs as well as lessen the burden on PD, which is exactly what we do not want to have as an additional burden. So Joel, are you okay with that one?
Yes.
Okay. And then recommend that the city of Tempe absorb extra costs for enforcement if analysis shows cost higher than the proposed $300 fee for retailers found in the violation. Are you okay with moving forward on that discussion?
Yes.
Okay. Then we have consensus on our 4 items that we needed for consensus to move this forward. Thank you so much, Joel. So we will go ahead and move on to item 4B, which is consideration for our next committee meeting. We do not have an agenda or suggestions for that next committee meeting set up yet. So future agenda items for any future meeting on the Human Services and Community Safety Committee will be announced at a later date. So you can keep checking in. Again, for updates on what we're doing here, it is it's www.tempe.gov/HSCS to keep in contact with what we are doing, to see what we are doing about this issue and other issues that are coming up for our committee. Let's see, so our next council or committee meeting will be Friday, January 27th at noon. And Joel, if you don't have anything else, we were adjourned.
Thank you. Appreciate it. Thanks, everyone.
All right, thank you. Thanks so much. Thanks, Joel. Thanks, Paul.
Thank you, council members.